Ruthy, as I introduce you all as being familiar to our M42 stage, always wonderful to have you back here. But let's set the context. When it comes to Microsoft, M42 and the UAE, a very special relationship. Let's give our audience an insight in terms of this.
Yeah, first of all, thank you for the invite. It's always a pleasure being at the M42 booth and on the panel and with our great partners. Definitely a very strong partnership with M42 for a few years now. I think, with technology bringing such a breakthrough to healthcare, with Gen AI allowing organizations to access data that is usually siloed, unstructured data, chatting with the data in natural language, eventually, it's about taking that technology and making it happen. And I think that's the core of the partnership with M42, because together we're really building solutions that are making that happen and bringing healthcare and better experiences to the world.
And that's a really great insight. It really sets the scene for us. Let's talk about some key examples that you're working on right now.
Sure. So, I would say it's kind of like on a platform level in terms of, just making sure all the infrastructure in place, making sure you know how to access the data, and then bringing the capabilities to actually extract insights from the data and make actions on the data. So if it's, taking genomics data and using it for precision medicine, or if it's taking doctor visits and making them, adding ambient solutions and returning the eye contact between the doctor and the patient, or it's even simplifying a letter that you get from the doctor so that you understand it better. And if you're a child, it could be a Winnie the Pooh story to make you understand how to use your asthma devices. So it's really leveraging the technology to make the healthcare more accessible and the experience better.
And I think we're going to dive into more of those examples in just a moment, but that certainly gives us a really good overview in terms of what you're working on and that very special relationship. You mentioned frontline physicians and doctors, so let's bring in one. Dr. Yazan, thank you for returning to our stage. We had a wonderful TED talk from you last time. You, of course, are a cardiac surgeon at Cleveland Clinic Abu Dhabi, achieving amazing results. Give our audience an insight in terms of your area of specialism and where you kind of see that intersection of technology allowing you to leapfrog forward.
Well, assalamu alaikum and good afternoon or good morning, everyone, actually. I'm Dr. Yazan Aljabery. I'm a cardiac surgeon at Cleveland Clinic Abu Dhabi. My special interest is actually in AI. I have a degree in AI in healthcare, and I'm leading some of the big projects in cardiac remote patient monitoring and 3D printing at Cleveland Clinic Abu Dhabi. And I think what my colleague just mentioned now is a very important topic. It is us as physicians enabling to bridge the gap between the technical possibilities and the actual clinical application. And this is, I think, why most of us are here today. It's how to apply these things on the ground and explore the possibilities and the actual patient outcomes.
So to underline that point, to bridge the gap between technical capabilities and delivering that frontline healthcare.
Definitely, definitely. So I would say it's one thing to talk about sensors, AI-driven technologies and algorithms, and witnessing this firsthand as a doctor, as a physician, and the impact it could have on those patients is a totally different aspect. Some make it, and some are unfortunately under the expectations.
Okay, and we're going to again explore that. But again, you really provided us that top level insight in terms of opportunities, but some of the challenges. We're going to delve into those in a moment. Dr. James Mault, again, like Dr. Yazan, you share that specialist background of being hands-on frontline, but also leapfrogging into the possibilities of AI. And I want you to give our audience an insight in terms of BioIntellisense. What's it all about?
Well, BioIntellisense is really, thank you, the culmination of about 25 years of an evolution of shall we say, progress in the first 20 years of my career being at the bedside in the intensive care unit. All of these bedside monitors, first thing you realize is continuous monitoring is a winner because we're able to see things happening and progressing or deteriorating. And when we look at the practice of medicine for the past 100 years, outside of the ICU, then we suddenly go from continuous monitoring to small snapshots while you're in the hospital. And then at home, we basically have very little, if any, information. So the first thing is, how do you take all that monitoring in the intensive care unit and reduce it down to something that is literally ubiquitous? And imagine reducing all of that monitoring equipment down to a simple coin-sized wearable, and then turning that into something that's literally continuous in any setting throughout not only the hospital, but at home. The next thing is you learn it's really all about the data that can be generated by these new wearable sensors that are now medical grade, and apply AI to watch this high-frequency, continuous data across multiple parameters. And the results are absolutely staggering. Reductions in hospital length of stay, reductions in ICU mortality, reductions in hospital readmission after you go home. And this is undeniably irreversible, because over the next 3 to 5 years, this becomes pervasive in the application of care for any patient, anywhere, any clinical setting. And you ready? Here you go. All right, we've got
Fantastic.
a picture there. Feel free to pass that around.
And I'll just interrupt because I appreciate that we have a lot of ambient noise. It's called a bio button, yes?
That's the bio
button. It's
button.
called a bio button. I remember last time you were on stage, I love the fact that you bring a prop in, and the idea that you're saying this is the new wave, this is the future, because you began by saying your point is not simply about gathering data as such. It's a certain type of data, and we're going to bring in Ruthy. Then it's a case of making that data so accessible that the patient can wear it outside the hospitals.
Everywhere.
Yeah,
both
everywhere.
in the hospital. So it's reducing, we also have a problem, healthcare workforce shortage. And so this is actually reducing the labor associated with manually measuring and freeing up those professionals to do, frankly, more important things. But I do want to make a small correction. The exciting thing is this is not the future. This is actually now. This is already 300,000 patients have been monitored across hospitals and at home with this technology.
With the bio button.
And M42 is literally the pioneer of this capability with the bio button here in the Emirates.
And I think that's really good that you emphasize that point, that this is happening now. We're wowed by it because it still feels like the future. But this is actually happening behind the scenes. It's being spread out, 300,000 people involved. So that's a huge scale study.
3 billion data sets already.
That's remarkable. On that point, 3 billion data sets. Let's bring Ruthy back in. How do we possibly process all of this data?
I love this because what Professor Mault was referring to is the fact that there is a huge shortage in workforce. And I was very happy to hear that Dr. Yazan is saying, doctors are using it, because that's, for me, I'm like, hearing you say this was the best reward, really, because, as Microsoft, what do I want to do? I want to make sure that we're really bringing the technology for your use, that you really have more patient-facing time, right? That you really have a 360-degree view of the patient, which biointelligence allows. So I think that's the most rewarding, the fact that we can automate processes. You guys all hear about agents. I don't know, do we know what it means? Don't know what it means? What it does, it's a little personal assistant that helps you do some of your mundane tasks. Think about it, right? So these agents know how to look at this data and extract the information from it and create that 360-degree continuous view. And these are exactly the places where, like you said, it's happening now. Like today, we have little AI assistants that help nurses go through the procedures that are not necessarily known to them, right? This we did in Basel. Or a doctor co-pilot. What is my next best action? Maybe, actually, we did a study with cardiologists in Australia, in Liverpool, Australia, and they entered all the cardiology research and then said, what is my next best action? And it gave them tests that they didn't think about before, which, that's an amazing thing for a doctor. So I think that's what it means that the technology is here now, and really each and every one here can apply the technology.
And I'm going to bring in Dr. Yazan on that point, but to build on what Ruthy said, you make a very nuanced point there. In a subtle way, you are outlining the reticence that still remains across the healthcare system. You're saying that you're very proud to hear that Dr. Yazan and his colleagues are using the technology. So that feeling of actually embracing the positivity means that there still is some reticence, still some challenges. Dr. Yazan, I know you want to come in, but also to elaborate on that point.
Yeah, so I have to echo what my esteemed colleagues just said. And I'll tell you from a first-hand experience, until just recently, the post-discharge phase of patient care was a black box. We let the patient go, and we wish him a good recovery. He has certain appointments, one after 1 week and one after a month. And during that time, we have zero knowledge of what's happening with the patient. Now, with this bio button, which we have started a few months ago, we know exactly what's happening with the patient, and we are detecting at a very early stage, alarming signs, even before the patient himself feels it. So imagine converting almost every home into a hospital unit without all the wires, the beeping, the noise, the fear that comes with it. People in the comfort of their homes are monitored by AI-driven command centers, by nurses that sit there day and night, 24/7, that have nothing other than caring for that patient, making sure that he is okay. And with this advanced alarm system, we are able to detect those alarming signs, preventing readmissions, preventing major complications from happening, and most importantly, we are saving lives. And we have so many examples just in a few months. We've started it since 6 months now, and we have more than or around 100 patients already in that program. And we have astonishing results and outcomes that couldn't have been possible without such technology actually in our hand.
And I think that's just really important to have this holistic perspective. What Ruthy describes is cutting-edge technology. All of the platforms that you're introducing and working with the UAE and in particular M42 on to actually provide the service that Dr. Yazan and his colleagues are able to then deliver. It's remarkable. It also does speak to what Dr. James, you and I have spoken about in the past. You have this wonderful analogy to do with aviation and reticence. I'm going to ask you to share it with this particular audience.
Yeah, it's kind of fun. We alluded to it. There's a bit of, forgive me, hysteria about AI. I mean, AI just sounds scary, artificial intelligence. And I've been doing this now in these speaking engagements. Raise your hand, everybody, if right now, today, you'd be willing to bet your life or death, on an AI system today. Raise your hand if you'd really be comfortable doing that today. How many people?
Okay.
Okay, that's more than
a few brave souls.
So 3, 4 brave souls. Okay, everybody listen. Raise your hand if you or someone you know has ever been on a commercial airplane. Anybody? Well, guess what? Keep your hand in the air. You've bet your life on an AI system. It's called the autopilot. And the pilots in that cockpit are relying on data from all these sensors across the airplane. Each GE engine has 900 sensors that are generating data at 120 hertz. I actually did the homework. and the pilots can't pay attention to all that data. Just like doctors and nurses in the intensive care unit, that's generating 1 million pieces of data per hour from those bedside monitors, and we've been there. And we can try to watch that data streaming by, but this thing called AI, it sounds scary, but it's really math, it's algorithms, and we as clinicians can start to take advantage of the power of an autopilot kind of capability to watch this data on our behalf and let us know, out of 1 million pieces of data, the things that we aren't able to see with the human eye or with human cognitive capacity. And what this is going to do is literally, over the next 5 to 10 years, this will be looked back upon as one of the most profound moments in the history of human health. There's no going back. And AI, like it or not, is going to be pervasive in every facet of healthcare. And it couldn't be more exciting. And that's what we're doing with this little sensor on your body, collecting the data as though you're in the intensive care unit, but having the benefit of a cloud that can watch that data. And just to put it in real terms, out of these 300,000 patients now, we are publishing a 20% reduction in transfers to the intensive care unit. And once they're in the intensive care unit, a 25% reduction in mortality just over a 6-month period of time, and then a 20% reduction in hospital length of stay. I mean, these are just profound, and we're just getting started.
And as you say, profound, and I really love that analogy because it allows us to take a different perspective on this issue. Powerful numbers, powerful results, echoing what Dr. Yazan is speaking about. Previously, patients went into a black hole. You then didn't have access to what was happening during their recovery. And echoes back to what you said earlier, Ruthy, this personalized care. But processing the data and what Dr. James was mentioning there in terms of allowing more time. I think that's the other way. And I appreciate that sometimes we are echoing these themes and they're similar across our events because the issues are still there. As you say, there is still some hysteria. So on that point of personalized care, I want you to give us a bit more of an insight. And I'm just going to say, we're going to open it up to our audience. We've got a few minutes on the clock. So if you have some questions, short questions, we will come to you in just a moment. But personalized care, that future of care.
So I think as was referred to, the idea here is that healthcare is becoming data-driven, right? If we thought healthcare was data-driven, now it's really going to become data-driven and AI-driven. So that's the idea behind the technology, and it's going to really happen in the next, even I would say 2 to 5 years, 2 to 10 years, And that's what will allow medicine to be personalized. Because when you can really look at the data, and the data is slightly different, because today medicine looks at most individuals. I mean, it's becoming more and more personalized, but this will allow it to become very personalized, whether it's protocols or specific care, or care that is even catered, not the protocol itself or the care itself, but how you deliver how to take care of yourself. So it's different if you're, an older person who doesn't have any access to technology, or you're a child, that if you understand your care, you're going to be more adherent with the care. So really personalizing the way we experience and deliver care, that's a lot of what we see across, and that's really where we have data-driven and AI health.
And I think that speaks again to that partnership with M42. It's a central theme. I promise to open it up. Any burning questions? Fantastic. Can we get a mic to our audience, please? To my team, can we get a mic to, or I can share my mic? Allow me to, okay, fantastic.
Yeah, excellent panel. I am from Apollo Hospitals in India. And this is amazing because we are doing exactly the same thing in an Indian model with about 2,000 beds of a hospital are linked up with exactly what you talked about. In the last year, we have done about 140,000 patients. Our code blues went to 0 because we have a team looking at everything and preventing that.
We're seeing the same thing. Literally,
thank you for sharing that. That's really good insight there. Thank you. Any more? Okay, we don't. So therefore, with just a minute or two on the clock, let's get a last call to action. I'm going to get you all to, you can address that question as well, but in your last call to action, what should we be thinking about paramount to our thinking when it comes to tech and in empowering health?
So I think we have the partnership with M42, we have a partnership with Apollo. I think it's really the power of the ecosystem, partnership with BioIntellisense, right? Of course, partnership with CCID. So it's the power of the partnership and the many players in the ecosystem that will make healthcare more successful. And I think that collaboration and those partnerships are key to success.
Okay, so partnerships, Dr. Yazan?
I would resonate that AI is not your enemy. Embrace the technologies that we have around us and trust in the system, in the ecosystem that we're forming, and educate yourself. Educate yourself so that you can use this data not just to track your health, but to actually understand it and take action.
And on the education point, I must point out that Dr. Yazan is prolific on social media, providing really insightful information. Do follow him, because that's the case, isn't it? It's correct information, not just any information when it comes to this field. So,
Thank you.
Dr. James, your parting words. The pressure's on you now.
No, it just couldn't be a more exciting time to be in healthcare, to be in medicine. And the reality is, AI is happening. You talked about embracing it. What we have to, there's also this process of trust building and then kind of letting go of kind of traditional behaviors. Frankly, we've been doing a lot of things in medicine for 100 years that haven't changed, and we're now going to see, and I agree with you, this is not a 10 to 20 year type of transformation. This is 3 to 5 years, and this is going to come upon us faster than most people are probably realizing, and sometimes that's hard. Sometimes it's challenging. Yeah, I mean, healthcare in general is slow to adopt, and so what's sad to realize, and you described it. Now you have to stop and think: if this is my family member, what would I want if they were in the hospital? Would you raise your hand if you would rather have someone checking on your loved one once every 6 or 8 hours while they're in the hospital versus a sensor that's watching everything every minute, every second, and an AI system is keeping track? It's no comparison. So knowing what we know, every day that goes by that hospitals aren't doing this, we literally know people are dying unnecessarily. So it's really incumbent on all of us to learn about this, understand it, communicate it, because we're all going to be better off. It's going to be better care for all of us and our loved ones. We're going to feel better as clinicians because patients actually are doing better than they've ever done before. And from a healthcare economics point of view, we're talking about hundreds of billions of dollars, at least in the US system, if these technologies are fully implemented. So I mean, you just can't be indexing on, oh, the what if. It's absurd.
And I really appreciate your comprehensive answer, because I gave you the challenge of summing up for us, and you always rise to the challenge, Dr. James. There in your answer, you gave us the context. The healthcare system is slow to adopt. The conversation about AI, as Ruthy explained earlier, is going at lightning speed. So how do we marry those two? In this conversation, we are taking a broad view. I'm going to encourage you to meet my speakers off stage. They're all very, very approachable. You might have your burning questions that you want to put to them directly. And these conversations are important for us to pause, to take that overview, and to provide the powerful examples you all have. To our esteemed audience, please give my panelists a big round of applause.